I'm going to be moving on to our next speaker, which is Gosling. Regard 30 years of campaigning for equality by LGBTQI plus disabled people. And so for this, I'm going to be sharing a film that Ju has very kindly provided, which is going to show her presentation. So I'm just going to disable the auto transcription because otherwise that will get in the way. And let's go to the film.
My name is Ju Gosling. I'm a white woman with pale olive skin, a self-styled hennaed corona crop, and green eyes behind black plastic glasses. I have black wrist braces, silver-coloured jewellery, and a rainbow brooch and watch strap. And I'm wearing a dark purple silk shirt and black leather blazer. Behind me are rainbow flags, and I'm sitting in a silver coloured manual wheelchair with bright orange rim covers and a lime green fake fur cover. For the last 20 years, I've been a co chair of Regard, the national LGBTQI disabled people's organisation. I mean by this that we identify as part of the international movement of organisations led by disabled people ourselves. Founded in 1989, Regard has four aims: to highlight disability issues within the LGBTQI communities, to highlight LGBTQI issues within the disabled communities, to combat social isolation amongst LGBTQI disabled people, and to campaign and work strategically on issues that particularly impact on LGBTQI disabled people. Regard has no core funding and no staff. Instead, the organisation is run by the members for the members, who are mostly LGBTQI disabled people ourselves, although we also offer associate membership for organisations and allies. In order to be as effective as possible, we have a large executive committee, and each person takes responsibility for one or more areas of work, regularly reporting back via email to the group. So, for example, we have members representing and working for the interests of people with learning difficulties, people with HIV and deaf people, members liaising with the disability and LGBTQI communities, members focusing on issues like social care and hate crime, and so on. We always need new executive committee members, so please do bear this in mind. We also have a Facebook page, a website, and a daily email group for our membership, where we circulate all of the information we receive about other activities, news, and campaigns from the disabled peoples and LGBTQI communities. However, many disabled people are digitally excluded, while others have no privacy and cannot be out because it's unsafe, limiting our reach. As many as 1 in 3 of the UK's LGBTQI population are disabled, compared to 1 in 4 or 5 of the overall population. This is due to the long term impact on our mental and physical health of discrimination, together with a higher incidence of HIV among gay and bisexual men. It's still common for someone to be rejected by our family or to have only superficial relationships with them, to be rejected by our childhood friends and to leave the area where we grew up, to have to hide our identity all of the time we're at work, to experience additional difficulties in meeting partners and setting up home together, and so on. This is extremely damaging to our mental health and also leads to behaviours such as addiction that cause long term damage to our physical health. Then there are people who never recover from physical attacks linked to discrimination, including head and spinal injuries. Stonewall has found that LGBTQI disabled people experience much higher rates of hate crime than other LGBTQI and disabled people, and generally are the most disadvantaged of all disabled and LGBTQI plus people. Many LGBTQI plus venues are inaccessible due to environmental, social, and attitudinal barriers. And this means that LGBTQI plus disabled people are often very isolated indeed. This in turn impacts on our mental health and makes us vulnerable to hate crime, including mate crime, where people posing as befrienders take over an individual's home and resources. Regard works to highlight the fact that LGBTQI plus hate crime victims are overwhelmingly disabled and pushes for policymakers and service providers to recognise this. We lobby organisers of prides and other LGBTQI plus events to implement our own guidelines to inclusion and accessibility, which you can find on our website www.regard.org.uk. We raise awareness of repeated failures to include disabled people with event funders. From now on, I'm going to include some poems which have been written in the last 12 months about the experiences of LGBTQI plus social care users and other disabled people during COVID-19. So for anyone who's feeling particularly vulnerable, I'm going to issue a trigger warning and suggest that you take a break from your live event and then come back for the last 10 minutes, which will be a question and answer session. If you wish, you can always choose to view the rest of this video another time on the Regard website. I'm going to begin with a poem called Careless, which I wrote last June, Pride Month. The story of our disabled community is the story of the wider LGBTQI plus community too. The majority of people become disabled in adult life, and 2/3 of disabled people are over retirement age. Careless tells the fictional stories of social care users in the first 4 months of the pandemic, based on all too common real life experiences, the shared factors in our history that make us particularly vulnerable to COVID-19 now. Without being able to draw on significant support from family members, childhood friends, partners, and children, LGBTQI plus disabled people have no option but to access state services and are heavily overrepresented amongst social care users. This includes care home residents. A national shortage of accessible and supported housing means that LGBTQI plus people of all ages are living in care homes. When LGBTQI plus people do use social care, research carried out by Regard with the University of Bristol, Stonewall, and the Social Care Institute of Excellence shows that we experience widespread discrimination. Again, partly because lack of community and family support makes us more vulnerable. Regard works closely with the Care Quality Commission, which regulates social care, the National Institute for Clinical Excellence in Social Care, which sets standards, and the Social Care Institute for Excellence, which creates practice guidelines for social care workers and policymakers. We also succeeded in the noughties in implementing monitoring of care home residents' sexual and gender orientation, although this rule is often ignored. Far from being encouraged to be out, before the Equality Act 2010, members living in care homes reported they were told they would be evicted if they came out to staff or other residents. More recently, out members have been asked to leave their care homes on the grounds that their peer support needs cannot be met and their safety from other residents not guaranteed. Careless. Pete isn't a dad, though he's somebody's son. Ellen is lovely, but nobody's mum. They both left home early and haven't been back. The same's true of Trudy and Melvin and Jack. Sue's not seen her kids since she came out as trans. Bill's son avoids him whenever he can. Trevor's lost touch with his sisters and brothers. And Kath's son has simply no time for his mother. Pete wasn't able to come out at work, so his friendships were limited, much as that hurt. He found love and found it again, and lost it once more, which has caused him great pain. Trudy's another who stayed in the closet. Her life and her livelihood both rested on it. Her happiest moments were clubbing at night, but she daren't risk it often, despite the delights. Ellen found her true love early in life, but wasn't entitled to call her a wife. And cancer came long before change in the law, so she's labelled a spinster, which makes her feel sore. Melvin has had a substantial career, successful and wealthy despite being queer, but developed MS when aged just 43, so his money was taken to pay his care fees. Jack spent his working life wielding a broom, sleeping and eating in one tiny room. Kicked out by his parents, he took no exams, and his minimal wages were paid cash in hand. Sue knew she was different when she was a girl, misgendered, disguised, and with massacred curls. When 3 decades later she found her true self, a judge took her children, then life took her health. Bill's lifelong partner is great and called Dan, but Bill has dementia, and once it began, since they couldn't afford to become partners in law, Bill's son got control and then showed Dan the door. Trevor trained as a teacher and worked in a school, till arrested and outed and sacked under rule. His crime being only to love until death, a dear man whose sudden loss left him bereft. Kath led a happy and sociable life, not wanting to settle for only one wife, but her son signed her over to state social care. Only family members can visit her there. It was March 2020, and all through the land, infection was spreading with each shaken hand. With each missing mask and each failure to act, with each mass event, each denial of fact. Then across England the coughing began. Throats filled with glass and eyes filled with sand. People struggled for breath as their fevers soared high. And the promised protection was founded on lies. Pete died the first week and stayed where he lay, till the carer who gave it him came the next day. Ellen died next after going to shop. She'd had no choice as her social care stopped. Then Trudy and Melvin and Kath became ill. And soon so did Jack and Sue, Trevor and Bill. As infection raged through 1 in 3 of care homes, with visitors banned, they all suffered alone. At the time of their passing, their deaths didn't count. It took far too long for the pressure to mount. And while they were dying, no ambulance came, since a doctor had put DNR by their names. No one wrote tributes to mum or to dad. No grandchild complained that their treatment was bad. Voices were silent or spoke the belief that for old and sick people it was a relief. No services marked their departure from life. No films were made for a husband or wife. No graves exist, and their ashes lie spread where no one can possibly notice they're dead. Now it's Pride Month, and still people are dying. Quietly, lovers and friends are still crying. Rainbows on windows served only to hide the rainbow that faded, then vanished inside. Sadly, as we're all aware, nothing has changed in History Month 2021. Care home residents are still dying in large numbers, and LGBTQI plus care home residents continue to be among those with the least support from relatives and the heaviest dependence on state funding, meaning they're living in the poorest standard facilities. Now, with COVID-19, younger residents who are themselves in good health and usually lead an active life in the community, and many working age disabled people spend years in residential care due to housing shortages. They've also been trapped in their care homes for nearly a year now. What is not more commonly known is that social care users in the community have the same high mortality rate as people living in residential care. Despite this, we've been denied the same priority for testing and vaccinations. In both cases, no records are being kept about the victim's sexual and gender orientations, but the unique circumstances of our community means that LGBTQI plus social care users are likely to be overrepresented amongst those who are dying in the community too. My partner and I have been shielding at my home since mid-March last year. We've had no visitors, no voluntary help, no family support, and no support from our own community. Without this support, we haven't been able to negotiate the local authority system successfully and obtain the PPE that we need for our social care users to come in. This means we've been locked down with our assistance dogs in Newham, one of the worst affected local areas in the world, reliant on deliveries and without access to our usual medical treatments. If we become ill, there is no emergency plan. However, to date, we've managed, so we're the lucky ones. Many more LGBTQI plus social care users won't have coped without the support structures that are available to straight people. I wrote the next poem, Metamorphosis, paused last spring when shielding was still being described as cocooning. Metamorphosis paused. A cocoon is a miraculous creation, containing everything needed to survive. A grub is reborn in blissful unconsciousness, emerging with unimagined abilities, soaring on wings to a richer, new life ahead. Caterpillars do not lose their rights when they enter into their cocoons. Caterpillars do not need to prove larvae status in order to eat. Caterpillars do not have to worry about how to wash their hand splints. Caterpillars do not struggle when they try to make a telephone call. Caterpillars are not abandoned without masks and gloves for their carers. Cocoons are insulated against dealing with officialdom. Cocoons do not rock with emotion nor shake with fatigue. Cocoons do not crack with every essential delivery. Cocoons do not splinter with every essential visitor. Cocoons promise futures, not lives perhaps permanently on hold. Cocooned is not waiting anxiously for neighbours to go in so you can clear up after your assistance dog in safety. Cocooned is not being enraged by reckless politicians and the selfishness of people sauntering past your front door. Cocooned is not always missing the people you care about. Cocooned is not being in fear for the lives of those you love. Cocooned is not having rows with the loved ones who are present. Cocooned is not sweating with panic each time the doorbell rings. Cocooned is not being breathless with pain as you cope alone. Cocooned is not being ever watchful for approaching death. Shrouded round in dread, we are not cocooned, we are suspended. In February 2021, the situation facing LGBTQI plus disabled people, and that could be any one of us tomorrow, is extremely serious. The vast majority of day services that many social care users previously relied on have not operated since last March. And as with ourselves, many people have also had to choose between receiving unsafe care at home and no care at all. This has also impacted on social care users' access to food, since many people were used to receiving their main meal of the day as part of a day service. COVID-19 is the biggest health challenge facing our community since HIV. Despite this, there's been no action from Stonewall, who refused to object when the coronavirus emergency bill significantly cut social care users' right to care. In fact, Stonewall's acting chief executive was on furlough when the bill went through Parliament, and staff at work told us that the only issue they saw with the bill related to civil liberties. Nor have we seen any moves by Stonewall to support vulnerable members of our community to get safe access to food, let alone more holistic help. Regard has tried hard, but alone we have been unable to get the government to accept that LGBTQI plus people have, as with other minority groups, been disproportionately affected by the COVID-19 pandemic and so need targeted monitoring and action. Overall, the UK has one of the highest proportions of COVID-19 patients who die from their infection. My final poem, also written in 2020, responds to the QALY system, spelt QALY, that underpins every treatment decision made by the NHS. QALY stands for Quality Adjusted Life Year, and the cost of treatment must always be less than the QALY value of the patient. I leave you to imagine the potential that this system has for unconscious bias and discrimination to impact on treatment decisions. My partner Julie, who is 73, uses a wheelchair and has COPD. A few years ago, she was featured in Claire Summerskill's book about our community elders, published by Stonewall. Julie was told last year by our GP that she would only be offered palliative care if infected with COVID-19. Care, which he explained, could simply mean a package of morphine being dropped off. There's no guarantee that myself, as a wheelchair user who's 15 years younger, would fare any better. In fact, our entire economic and political system is based on the assumption that some citizens' lives are worth less than others and are expendable. Compare the much lower COVID-19 mortality rates in countries where the life of every citizen matters in law. Quality of life. How much is my life worth, and how can I tell? There's a formula that I know only too well. My life is costed by symptoms, you see, not the value it has to you or to me. You can't fetch top price if you roll round on wheels, even a businessman making big deals. There's a further discount if you can't hold your wee, even if you are an active MP. If you can't see too far or simply can't hear, your life is not considered so dear. There's more off if you need support from another, even if you are a competent mother. And pain is considered a definite no, whether or not people in pain say so. The government costs you before they will give the NHS treatments that you need to live. Your life must be perfect to gain a full QALY before you are even put onto a trolley. If you can't leave your house, then your value is cheap. The state won't spend much money for your life to keep. And maybe that's one reason more people die of COVID-19 in the UK. And I am afraid of the verdict if I become ill. Before I sleep, I have miles to go still. We may be a good parent, a partner, or neighbour. Whoever we are, we're all more than our labour. Yet, whoever we are, our lives are still judged on our cold market value, not how much we're loved. These slavery values must come to an end. What kind of price can you put on a friend? Your brother, your grandma, your child, and your wife? How can a price be placed on their life? The values that matter are those we all share. How much we give, and how much we care. It's time to abandon the checkbook approach. Love is the quality that matters the most. In 2021, we need the power of love more than ever. Love for ourselves, love for each other, love that leads to action, that leads to change. Together, we can change our world.
Thank you very much, G. That's just brilliant. Just like to welcome Ju to the panel. She's on her way in now. Thank you so much. It was a fantastic, I mean, gosh, what a hard-hitting message, but, you know, very emotional. So thank you for that magnificent presentation, Ju.
Well, thank you for inviting me, and I just felt I really enjoyed the first presentation, but I just felt they went so well together.
Yes. Yes, indeed. Well, we haven't got any questions. Please do ask some questions. Anybody that is listening. I'd like to take a few questions for you, Drew. How your poetry is really quite amazing, really. Do you find yeah, how do you start that creative process, and do you find it quite a cathartic process for yourself?
Well, I mean, thank you for asking the question. Those are, yeah, in terms of poetry, that's the only poetry I've written since COVID began. And I haven't written anything since those poems. And I think probably the last of those was June or July. And I think it just got to a point where too many people had died. And it wasn't just COVID. I was putting on a digital festival, and the poet who was performing at the poet who was performing at the opening, who was a young black poet, was murdered in the US. And so, no, actually, I feel like I can't get anything out of my system like that at the moment. I'm beginning to sort of feel drawn back to it. But I think those times it was just simply that it was the only way to express it, and those characters in Careless very quickly, well, it just wrote they seem to write it themselves in a way, and particularly that one, it was those stories just waiting to be told.
So we've got another message from a question from Shan. What steps could we be taking to make a change now, is her question.
My key thing is talk. We have to start talking about this, because once we start talking about it, other people start talking about it. We can put pressure on people. I think it is about talking, but also, of course, on a personal level. If there's one person who's shielding on their own or is closeted on their own, anybody you can reach out to on a personal level. I just think that's so important. Our community's been so fragmented, and I think a key thing is because we meet at community venues, that's why disabled people become so isolated so quickly, if they develop an impairment or become more disabled. So I think it's, let's talk about it, let's make it public, let's start asking questions of politicians and Stonewall and people who do have some power. But yeah, let's just spare a thought for somebody maybe we've not seen for even 5 or 10 years, but let's just check up on them.
That's really good advice. I think we all need a little bit of extra kindness at the moment. And another question we had was, what advice would you give to young people now? Gee.
Oh, that's a really big one, isn't it? I think actually, I'd come back to that message about love, and it was really important to me to say we have to start by loving ourselves. And, the first presentation, we heard all of these statistics about however much we try to love ourselves, that hate from outside can be very, very difficult to deal with. So, yeah, I think it's about pride, it's about self love, and knowing that you've got just as much right to exist as anybody else. What doesn't matter about your background, your education, your culture, your gender, your sexual orientation, you are absolutely have as much right to everything in life, and you're entitled to be happy. And that may be a great struggle, and I do feel like I'm just an old hippie at the moment preaching peace and love, but actually those things are the most powerful things in the world, and we cannot let the sort of hatred that we've seen raging through the West stop us. We have to turn around and say, no, love is stronger.
Absolutely. Yeah. I was just wondering if, there has been, with the COVID-19 crisis, have you seen sort of, it's been interesting watching It's a Sin and the AIDS kind of crisis as it was then, and then kind of, making those comparisons between that crisis and obviously COVID, and reflecting on that a little bit. Do you see any similarities or differences in these? Obviously they are different, but
Yeah, I haven't been able to watch It's a Sin, and again, I've just haven't been able to go into sort of the memories of people we lost.
mm,
And we lose.
and
I've lost a lot. I know a lot of people who've died of COVID because of yeah, because of who I am and the age I am and where I work. So I actually haven't been able to face watching it. But yes, what I have think has been interesting is people have started talking about mental health, and that's critical. But there can be a danger that there's a sort of separation, if you like, between disabled people are irretrievably unhealthy, we don't want to bother with them, and then there's non-disabled people whose health we need to restore. And I'll give you an example of that. There was a Mind Body Spirit event for the LGBT plus people of color, I think in 2019, and everybody was terribly excited about it, and it was all about health, but it was at the Scala. Now, the Scala, you have to go up steps before you can even get in. They have no lifts, they have no accessible toilets. They're very blatant about it, and it's actually illegal to go and deliberately hire a venue, to be inaccessible. But it was very much saying, to me, it was really pushing that kind of, if you're a man, a gay man of color, you have, health. What health looks like is you have to be able to get up hundreds of stairs before you can even get into the event, and it just was like saying, well, if you're disabled, you can't be healthy. So although we're having these conversations, the conversations I really want to have are, what about the people living with long-term health problems? What about people with conditions like schizophrenia that are not going to go away? What about bipolar people? How do we support them much, much better? So it's great to see people finally saying, actually, we all struggle with this huge burden of discrimination on our mental health. But the goal shouldn't simply be to say, well, some of us should be able to return to whatever this kind of bizarre concept of full health is, and the rest of us can just fall by the wayside. And I think another difficulty, if you like, I see a sort of contemporary shift towards seeing people as sexual minorities, which I think is the danger, if you like, where you start talking about people being aromantic. And yet, once you're a sexual minority, disabled people are seen as being completely asexual and incapable of having sex. So, again, we become completely invisible as soon as you have that kind of discussion.
yeah, there's some really important points there, G. And I think it's so important to recognise each person as an individual, and that, as you say, they're just intrinsic value as a human being and person in their own right. Yeah, just so important. So we had one last question, which was, and it sort of connects a little bit with, how do you approach educating people who don't know anything about the LGBTQI plus community and discriminate against them? Big question.
Yeah, I think it is a big question. I almost feel like people who are clueless are relatively easy to deal with, because you can at least proceed on the basis that if you educate them, they might be reasonable. I think the difficulty is, and what we've seen is such a celebration in the US over the last 4 years of people who know perfectly well. I was interviewing, or was being interviewed by, really, a young trans person a couple of weeks ago for a live stream that I actually run 3 times a week for an organization called Together 2012. And what they were saying was that because people at school knew more about LGBTQI plus issues, they were actually able to target them more precisely. So education, yeah, I think educating the ignorant is a very straightforward, relatively easy thing to do. And certainly we need to do a lot more of it. But I think the difficulty is that there's a lot of educated people who are using that knowledge, to target people and to discriminate. Indeed, within our own community, of course, as we know, not everybody wants to be under one glorious LGBTQI plus umbrella.
No, but thank you for answering that. That's great. Well, thank you so much, Stu, for your time and for your brilliant presentation and for answering all those questions. That's been
It's such
wonderful
a
to have you.
pleasure. I think the only other point I would like to make in terms of education, but I think everything, I was thinking as we started this talk of a couple of friends, one of whom died of COVID, who's a trans woman, Lynn Levitt, Catherine Arinello, who died the year before of a chest infection. We're not very good, I think, in certainly in the LGBTQI plus disabled community, of saying, well, now we need to create biographies of these people. These people were important artists. Catherine was an international artist. Lynn performed internationally with Para Orchestra. They have these amazing stories. How do we start processing those into becoming future resources? So I think that's the kind of thing that I'm really taking out of this year. As we're losing people, we mustn't forget them. And I think that's the other thing. If you know somebody who's been lost in the last year or so, whether from COVID or something else, let's make sure those biographies are written, those records are kept. Don't leave people to die invisibly.
Absolutely. I think that's a really lovely message to take away, to remember those that we've lost, but have been so valued and loved. So thank you
And I
very much,
think
Stu.
can inspire us so much more.
Mm.
If you know that somebody's managed with severe cerebral palsy and only managing to communicate with their nose to get out of Wales and become an international musician, I think that's quite inspiring if you're struggling with the fact that you've just been denied your blockers. So, yeah, I think history is so critical, isn't it, to our present? Thank you again.
Absolutely. No, thank you very much.